So as Phil mentioned, I'm an exercise physiologist, and I'm also a cancer exercise specialist. So I work 100% of my day with people with a cancer diagnosis that are going through treatment, pre and post surgery, and into long-term survivorship, helping them mostly overcome the side effects of cancer treatments and surgeries. I just want to acknowledge today that funding for our program, so at the Supportive Care Program here, is an initiative that's provided from the Specialist Services Committee, and that's a joint collaboration of the Doctors of BC and the BC Ministry of Health. We also get funding support from the Prostate Cancer Foundation BC and philanthropic donors as well. Okay, so that's kind of how we exist here. It's a really unique program of supportive care for people with prostate cancer that doesn't seem to really exist anywhere else. So what are we actually going to talk about tonight? We're going to look at what exercise is, all right, and why you should exercise. So they're two pretty important things that we're going to start with. Then we're going to move on to how much exercise is required, and then how you can specifically perform exercise to overcome side effects of some of the prostate cancer treatments and surgeries. We'll look at exercise for long-term survival, and then how to get started and how to do it safely. Because it's really important that if you're going to exercise, that you're doing it safely. Everything we talk about tonight is evidence-based. So we're really lucky now that we have years and years of research that helps us to prescribe things really effectively. Okay, so we can have really sound prescription of exercise because we have really good research into that area. So what is exercise? Exercise and physical activity are different things. So exercise is structured, it's repetitive activity, and it's performed with the intention of improving one's health. So just think about that for a moment, and think about maybe if you have any structured and in exercise with intention in your day-to-day life. So this could be things like walking or swimming or cycling or going to the gym. But it's not necessarily just walking around the shops. It's more with that intention to improve your health. So for some people, if they were walking to go out and they knew that they were doing this for their health, that could be classed as exercise. It normally has a certain intensity involved with it. But the other side of things is going to be physical activity, and this is where people get confused. Physical activity is more general. It refers to any bodily movement produced by skeletal muscles that results in energy expenditure. So if I get everyone to stand up, let's go guys. Yeah, it's an interactive session here. So I'm going to get you all to stand up and then just march on the spot. I want you just to march on the spot. All right, so right now you're doing some physical activity, all right, and then I'll get you to sit down. And if we were to continue that for an extended period of time, then it might actually end up being exercise as well. So things like your household chores come under physical activity, general walking, daily activities, any kind of thing where you're moving most of the time. And then the third piece, which is quite opposite to the other two, is sedentary behavior. So that's any waking activity with very low energy expenditure. So it's not when you're sleeping, but it's pretty much everything else where you're seated or reclined or laying down. Okay, so if you think about your day, just start to add up those minutes or hours that you might spend sedentary. We're going to talk a little bit more about sedentary behavior in a little moment. So why should you exercise? The leading cause of death for men with prostate cancer is cardiovascular disease. So if you have a prostate cancer diagnosis, you are more likely to die of heart disease than you are of prostate cancer. Now we have even more research on heart disease and exercise than we do on cancer and exercise. So we know how we can reduce your risk of heart disease. We know that exercise is very, very effective at reducing your risk factors for heart disease. So there's lots of things that we can do proactively to help reduce your risk factors. Exercise is safe and it's effective. It's an effective adjunct therapy for patients with prostate cancer. And so the piece that I want you to take out of that is that exercise is safe. There is lots of research, lots of guidelines now internationally that show that exercise is safe. There are some times throughout your treatment journey where we might encourage you to do different exercise or to refrain from exercise for a short period of time. Like straight after your prostatectomy, potentially, you're going to have restrictions around your movement. But as long as you're following certain guidelines, we can keep exercise very, very safe. It's been shown to improve the strength of your body, okay? It's been shown to overcome side effects of treatment. Exercise is also the most effective and evidence-based non-pharmaceutical intervention that we have for prostate cancer and cancer in general. And we can throw in any kind of chronic disease for anyone else that's sitting in the audience thinking, well, I don't have prostate cancer, but I have obesity or I have heart issues. We know that it is the most effective and evidence-based non-pharmaceutical intervention. So what that means is that we use it as medicine, okay? It's not a pill that you get from your doctor, but hopefully your doctor has prescribed it to you and told you that you need to exercise, because we now know that it can help you improve your physical and psychological status when you're going through this journey. Now, with prostate cancer, there are many different stages that people go through, from initial diagnosis. Some people are on active surveillance, other people have surgery, other people are on hormone therapy, you might have radiation, you might have chemotherapy. And we know that in all those different states, that exercise has been shown to be safe and effective. So why else should you exercise? Well, it helps to manage and reduce the negative side effects of treatment, like surgery, radiation, ADT, which is also hormone therapy. We use those terms interchangeably, and chemotherapy. Some of these side effects are things like fatigue or bladder incontinence. We're going to go through all of the side effects that you may experience tonight. Body composition changes, weight gain, muscle loss or muscle atrophy, bone density changes, balance issues, all of those kind of things, some mental health issues too. So that's all of those things exercise can actually help with. Now, the other reason that we need to exercise is that it increases survival rates. So if you're in this room, chances are, if you're a male, that you have a prostate cancer diagnosis. And we now want you to live as long as possible with that diagnosis. Now, we know one of the good things about prostate cancer is that we have very effective treatment, and for most people, it's very slow in how it advances. So we know that we can help you to live very, very well for a very long time, and hopefully die of something else in a long, long time. One of my patients that I work with continually tells me that he's hoping to not die of prostate cancer, right? So he's working so hard, and it's like, why do you keep coming to the gym? He's like, because I'm not dying of prostate cancer. I'm going to die of something else, all right? He wants to live into his 90s or longer, and he wants something else, not prostate cancer, to be that end. Now, we've got lots of research. So this information up on the screen. So there's a study in 2011 by researchers, Kenfield and colleagues, who found that if you walk for greater than 90 minutes per week at a moderate intensity, that you can lower your risk of death from any cause by nearly 50%, just by walking for an hour and a half a week at a moderate intensity. Hopefully all of you in the room do that. That's 3 30-minute walks per week. These researchers also found that vigorous exercise, so this is the hard stuff, it's the stuff that's uncomfortable. You know when you're doing vigorous exercise because you feel it. So vigorous exercise for 3 or more hours per week can lower your risk of death from prostate cancer by 61%. 61%, all right? So I know what I would be doing if I had prostate cancer, and that would be building up to do vigorous exercise. Now, vigorous exercise isn't appropriate for everyone in the room right now, but we can build you up to that point, and it may take you a month or it may take you 12 months of guided exercise to get to a point where vigorous exercise is safe, okay? Now, a really interesting study came out this year, and it was looking at recreational physical activity. So this can look at things like kicking a soccer ball around, playing some golf, doing something that probably is considered a little bit more fun than maybe going to the gym or walking up a big hill. Now, recreational physical activity is associated with a lower risk of death from prostate cancer. So that's also good to know. So it's not just a structured exercise that has been shown to be good. The recreational stuff too is now, there's lots more research going into that area. They're showing good benefits from that. So what I take from this slide is that movement is key. Okay, so if you're not moving at all right now, you need to start moving. And if you're already moving, we need to find a way to probably make you move more vigorously, if that's possible for you. And the more vigorous you can move, the more often in your week, the lower your risk factors are, okay, for death from prostate cancer and death from any cause. So let's look at sedentary behavior. So sedentary behavior, as I mentioned earlier, is anything we're doing in our waking hours where we're seated, reclined, or lying down. It is an independent risk factor for cancer. So regardless of whether you go to the gym, if you sit down for multiple hours per day or are sedentary for multiple hours per day, you're at risk of getting cancer or getting another cancer. Let's have a little look at this little graph here. So if we have a look at Anne down the bottom here, we can see, now the grey is sedentary. So Anne is probably the worst example, or the best example, let's say, of someone who's very sedentary in their day. Anne wakes up in the morning and she gets ready for work, but she sits down, reads the paper, has her breakfast. She sits down in her car. She lives an hour away, so she drives to work. She gets to work, which is a desk-based job, and she sits down. She goes for lunch and she sits down to eat her lunch. She goes back to work and sits down to continue working, drives home for an hour, gets home and thinks, I'm exhausted. So she sits down to relax for a little while, sits down while she has dinner, watches a little bit of television at night, and then goes to bed. So Anne is sedentary her entire day. All right, there's a lot of people that can probably relate to something like that, especially if you commute long distances in your car, because it's much harder for you to be active while you're driving. Let's now look at Kim. So this is the second from the top. So Kim wakes up in the morning and she goes to the gym, right? So this is a green. The green is good exercise. She gets her hour workout in, and then she's sedentary for a little bit, reading the paper, and she goes to work. She walks to work, and then she sits down for a while at work. Then she goes and walks around at her morning tea break, and then she sits down a little bit more at work. That's the grey bit here. And then at lunchtime, she realizes, I should probably have an active lunch. So she'll go for a 10, 15-minute walk at lunch. And then she sits down in the afternoon and does a solid 3 or 4 hours of work, and then walks to her car, which she's parked about 10 or 15 minutes away from her office, gets home, has dinner, watches a bit of TV, and then goes to bed. So if you look at Kim, she's only got about a third of her day sedentary. And she's got about a third of her day where she's got in the green there, her exercise time. And then the rest is that kind of active, kind of physical activity kind of behavior. So it's non-sedentary. So she's actually doing pretty well. If we look at her cancer risk, it's pretty low. The red is the highest risk up here. So what I want to encourage you is to think about times in your day where you sit down, where maybe you can stand, or maybe you can walk. Try standing up for some of your phone calls, because guaranteed you'll still be able to speak while you're standing, all right? You might not be able to multitask as much if you're used to doing 10 things at once, but you'll still be able to speak to that person on your phone. Some people like to go for a little walk, even just pacing around the room while they're on their phone to get movement in. Other people like to use the ad breaks. So if you are watching television, and if you're watching real television that has ad breaks, then you can use that ad break time to stand up and either do something. Go to the kitchen and get some water, not necessarily food, but water, or stand up and march on the spot. Okay, it's boring and horrible, I know, but it's better than sitting there for your body, and it breaks up that sedentary time. So start to think about that now in your day tomorrow and beyond, of how you can get more movement in. So exercise. What are the benefits of exercise? We have evidence to show that exercise can help improve our cardiovascular health. So that's the health of our heart, our bone density, cancer-related fatigue. One of the most common, or the most common side effect of any cancer and cancer treatment is cancer-related fatigue. All right, we know exercise can help with that. Bladder incontinence, very big side effect when we look at prostate cancer treatments, and I'm sure many men in the room will be dealing with or have dealt with some bladder incontinence. Sleep. Exercise can help improve your sleep. Our body needs sleep to function and to heal, so it's really important that we get quality sleep. It can improve our muscle mass. So this is kind of the size and bulk of our muscle, which is also really important as we age. We want to have good muscle mass to ensure that we, one, don't fall, all right? We want to stay independent. We want to make sure we can do all those tasks that we enjoy doing. Our muscle strength, so the ability even to walk up a hill or walk up a staircase is really important, and that's muscle strength. Our blood sugar control. A side effect of sedentary behavior is often an increase in our blood sugar, okay, and a decrease in our ability to control that, which can lead to things like diabetes. So exercise definitely helps control our blood sugar. It helps us maintain weight and flexibility. Now, current research supports that exercise and physical activity assist in cancer prevention, cancer recovery, preventing cancer recurrence, and supporting long-term survival. All right, so if you're here, we might not be able to prevent you getting prostate cancer, most likely, but we can definitely look at helping you do the best through your treatment that you possibly can. All right, we can help you look at the best long-term survival possible and preventing recurrence. So how much exercise is recommended? This is probably the most important slide that I'm going to show you all night, and I'll test you at the end, and I guarantee you'll all know these numbers because I'm going to say this multiple times. So we need to exercise 150 minutes of moderate to vigorous intensity exercise per week. All right, so 150 minutes, moderate to vigorous physical activity per week, and 2 resistance training sessions per week. Now, I want you to really be honest with yourself and think about how intense was your physical activity. Was it moderate to vigorous? And we're going to go through how you define that shortly. Now, if you think it was moderate to vigorous, that's really good because most people I meet are doing mild exercise. They're going for a walk. It's easy. They tick the box. It feels okay. There's no heart rate elevation really. You're not sweating. You're not really out of breath. But you went for a walk. So that's better than not going for a walk. However, we can be even better and get it moderate to vigorous. Because what the research tells us is that if we have it at moderate to vigorous intensity, we're going to help best increase our chance of survival and prevent other chronic disease. The resistance training is really important. I'm constantly getting people to start resistance training either in their home or in a local gym or however they need to do that. It's really important to build muscle mass. So resistance training is weight training. You've been doing some of it tonight, sitting and standing. Okay, we're actually training our legs. So we don't need fancy equipment. And I'll show you guys tonight some exercises that you can do with your body weight that's considered resistance training that you could potentially go home and start, all right? So if we look at cardiovascular exercise, this was 150 minutes. We can break that down for your week. So that looks like 5 30-minute sessions per week. Now, it doesn't have to be 30 minutes, but that's just how most people will break it down. They go for a half an hour bout of exercise, all right? Now, the good news is that can be accumulated. So if you don't have time or energy to do half an hour in one go, you can accumulate it in 10-minute bouts. So you might do 10 minutes in the morning and 10 minutes in the afternoon, and maybe 10 minutes later in your day, all right? And that's how you can accumulate your activity. Research has shown that it's very effective and still has very good results if you do at least 10 minutes. But 6 minutes isn't enough, okay? It has to be the 10. And then we can accumulate that and add it all up, and it will count towards your total of 150 minutes. Now, for weight loss, we need longer. So if you're sitting there and you have a prostate cancer diagnosis and you know you're overweight, chances are you're going to need to do more. So you're going to have a longer session of 60 to 90 minutes is recommended for the weight loss component. And cardiovascular exercise are things like walking, swimming, cycling, dancing, going up and down stairs, dragon boating or rowing, all of those kind of things that get your heart pumping, all right? Vigorous, because this is actually physical activity too, vigorous gardening or vigorous household chores can count, as can things like golf. If you're doing them at the intensity, that can be considered moderate to vigorous, all right? So how do we measure that intensity? We've got 2 ways I'm going to show you tonight. One is called RPE, or rate of perceived exertion. This scale I'm showing you tonight is between 1 and 10, And it also exists between 6 and 20, but it's a little bit harder to work that one out. So we'll go the 1 to 10 scale. So moderate activity is 4 to 6 on this scale. It feels like you can exercise for hours. You may be breathing a little heavier than normal, but you can keep a short conversation. So you won't be able to speak like I am now, but you will be able to answer in more than 2-word answers, all right? Now, vigorous is 7 to 8 on that scale. It almost feels uncomfortable. You can barely speak a sentence. You're probably, at this time of year, you would be probably sweating, all right? You can feel your heart pounding, but you feel like you've got a little bit left. It's not 100% effort, but it's definitely hard, okay? So vigorous exercise is hard, and moderate is a little bit below that. Now, the other way that we can measure this, and this is the way that we do it in the clinic setting, is by using heart rate. So the RPE is very subjective. It's how you feel. And that's okay. That's a pretty effective way of measuring things. But if you're not very good at like tuning into your body and understanding how you feel, then we're going to need to use heart rate. So we put a heart rate monitor on you, on your chest, and then you wear a watch and it'll tell us your heart rate. But you can also palpate your heart rate. So if everyone puts out their hand and puts 2 fingers just kind of below the thumb side, just gently there, you should be able to find a pulse. Hopefully. Everyone got a pulse? If not, you can gently do it here, but it's better if we do it at the wrist level. So you should be able to find your pulse. So what I'm going to do is I'm going to time you for 15 seconds and you're going to count how many beats you feel. Go. Okay, so whatever number you got, I want you to multiply by 4. So if you counted 15, your resting heart rate is 60. Okay, if you counted 20, your resting heart rate is 80. So whatever number you got, multiply by 4, and that's your resting heart rate right now. Now you've all been sitting for over 5 minutes, so that's a pretty accurate resting heart rate. Now I want you to know the normal is between 60 and 100 for our resting heart rate. Now when we're exercising, we use a more complicated formula to work out moderate and vigorous intensity. And I can talk to you about that later if we need to. It's too complicated to go through in a group setting, but I can help you work it out later if you would like to. But basically it's kind of 50 to 70% of our maximum heart rate, not our resting, is moderate. And vigorous is 70 to 85% of our maximum, okay? Our maximum is normally about 220 minus our age, really roughly speaking. So I can help you work that out later if you want to know where your heart rate should be. On most smartphones now too, you can have a little heart rate sensor that you put your finger up to the camera. So I know an iPhone has this, I know my Samsung has this. You put your finger to the camera and it will tell you your pulse. So it's not a continuous measure, but if you're out walking and you don't want to buy a monitor, that's fine. Turn it on at the top of the hill, quickly measure it, and it'll tell you what your pulse is. And then you know if you've worked too hard or if it's been too easy, and you can adjust it accordingly. So moving on with our exercise guidelines, resistance training. So how much resistance training do we do? We need 2 sessions per week. So that might be a Monday session and a Friday session, let's say. Now each session should include 8 to 10 exercises, and we're doing 8 to 12 repetitions of each. So what all of that means is those squats I've been making you do tonight, standing up and sitting down, that's one exercise. Another exercise might be holding some weights and doing a bicep curl. Another exercise might be a push-up or a calf raise, and we're going to go through all of these later. Repetitions are how many we do. So if I'm doing bicep curls, if I do 8 of them, that falls within the guidelines. And then we also want to do multiple sets if possible. We know you'll do better if you do more than one set. So one set of 8 will get me some change in my muscle if I do that twice a week. But 3 sets of 8 each session will be more beneficial. And we want at least one exercise for each muscle group. So that includes your legs. I meet lots of people, and your abs. I meet lots of people who just do upper body stuff. But your legs and your glutes and your abdominals are some of your biggest muscles in your body, and we need to work them as well. So 2 times a week, 8 to 10 exercises. And I'll show you what those exercises can be in a little bit. Flexibility needs to be performed on days that exercises are performed. Otherwise, you'll get tight. I was chatting to somebody earlier who's increased their exercise, and they noticed that they were getting tight because they weren't stretching enough. So if you stretch on days that you exercise, you'll start to increase your flexibility and not be so tight. And we can go through stretches later as well. And for older adults, so that's defined as being over 65 years, if you're at risk of falling, you need to add balance. So a balance exercise might look something like just standing on one leg. So let's all stand up and hold on to the chair in front of us. We're going to lift one foot up into the air. Good. And let's try the other side. Lifting one foot up into the air. What you're doing right now is a balance exercise. Now, if this feels really easy, you can not use the chair as much or not use it at all. You're not allowed to fall. And you can hold for a little longer. We're standing tall. We've got our abs on. And then we're going to change sides. This is good. You guys are advanced. Good. There's not too many wobbly people. So another balance exercise. You guys you can have a seat now. Another balance exercise is heel to toe walking. So it's literally what it sounds like it is. You walk heel to toe, and you'd have a wall near you if you're a little bit unstable. So you kind of tightrope walking forwards and then backwards. And then if you're in a hallway and you're holding onto the wall and that's too easy, you can close your eyes. All right, only if you're holding on. So there's all these ways we can challenge our balance. And I strongly encourage everyone to start some balance work. Because when we lose our balance, we lose our independence. And that's a really scary thing for a lot of people, to not feel confident walking or moving around their home or moving outside of their home. Okay, so we want to keep your independence. Okay, so that's the basic guidelines. We're going to get more specific now. So how many minutes of cardiovascular exercise do we need per week? Good, 150. How many times are we doing resistance training? Twice. Good. How many times are we stretching? Every time we exercise. And balance, it basically just says to add it in. There's no specific amount of times, but I recommend you do it daily. Some people do it when they're brushing their teeth. They stand on one leg. Or others do it in the ad break while they're watching television or while they're on the phone. Okay, so something to think about. So how do we make all of this specific to your needs, your goals, your history, and your cancer treatment? This is the part that basically I specialize in, is helping people understand how to make it specific. So if we look at patient types, within prostate cancer, there's 3 types of patients. There's those that are on active surveillance. So that means you're being diagnosed with prostate cancer, you have a rising PSA, most likely, and they've decided to not take any action right now. So they're just going to watch and wait. Okay, it used to be called watchful waiting, I believe. And so during this stage, we're trying to get you active, and your exercise goals are purely to slow the progression of the disease and to maintain good overall health. Because we know that the more physically active you are, the slower your disease will progress, okay, and the healthier you're going to stay. Now, if you're in group number 2, which is a recent or an upcoming surgery, this is normally a prostatectomy in this setting. If you have an upcoming surgery, we do what we call prehabilitation. So that is pelvic floor or Kegel exercises prior to surgery to help strengthen that area to hopefully minimize urinary incontinence post-surgery. We also know from lots of research that the fitter and stronger you are prior to surgery, just in general, that the faster you recover and the less incontinence you will experience. So if you have an upcoming surgery, I encourage you now to get started, even if it's just walking. And we're going to go through pelvic floor work too in a little bit. Now, if you have a recent surgery, so you've had surgery, then you're going to be on some certain guidelines first. So the first 6 weeks, we have restrictions. You're not allowed to lift over 10 pounds. You're not allowed to do anything too strenuous. But you are allowed to walk. You can move. And you are allowed to do pelvic floor exercises. And you should be doing them multiple times per day because they're going to help minimize the incontinence that you will experience. And if you're in the 3rd group, so this is hormone therapy or ADT, radiation or chemotherapy. So these are some of the other treatments that we use, and often they have greater and larger amounts of side effects. If you're in this group, our exercise goals for you are to manage the side effects of treatment. So these are things like fatigue. They can be things like bladder incontinence, like body composition changes. Lots of different things can happen with all these treatments. And we're going to go through those in detail now. So common side effects of different treatments. So we can see here that from surgery, the most common side effect is urinary incontinence, erectile dysfunction, and if you've had lymph nodes removed, you can get what's known as lymphedema, which is kind of a swelling. It's less common in prostate cancer. If you've had radiation, bowel irritation, fatigue is the big one here. Urethral stricture and erectile dysfunction are common side effects. If you've had hormone therapy or ADT or are on hormone therapy, things like hot flashes, osteoporosis, a loss of muscle mass, increase in weight, fatigue, depression, decreased sexual activity and libido, and decreased quality of life are all side effects that can happen. And if you've had chemotherapy or are having chemotherapy, then fatigue, peripheral neuropathy, shortness of breath, and reduced heart function are side effects that you can experience. The reason we're going to go through all these side effects tonight is not to scare you, but it's to hopefully educate you on what you can do and how you can use exercise to help overcome them. So let's first start with urinary incontinence. So pelvic floor exercises are what we use to help improve your continence, so your bladder control. Research shows that pelvic floor or Kegel exercises improve the condition of the muscular sling. So if we have a look here at the picture, this red part where the pointer is now, that's kind of your muscular sling. That helps you maintain your continence, so your pelvic floor function there. And we know that Kegel exercises will help you maintain that and control and the function of your bladder. So I meet some men who have leakage, all right, that they can't stop. So they have bladder incontinence. That's normally very early after surgery that's something that's happening, or while you're on hormone therapy. And then others that just have an urgency. So they might need to pee every half an hour, but they're not leaking. So there are differences with our continence, all right? Now we're going to do an activity that involves pelvic floor activation. So I want everybody to sit up nice and tall. Let's get good posture. All right. We have a pelvic floor physiotherapist that works as part of our program, and she's amazing, and she gives an education module. So if you haven't been to that, I encourage you to go. And if you've had a prostatectomy, at a certain point, you're eligible to go and see her for 3 sessions to help with any incontinence that you might have. And I also encourage you to sign up for that if you're eligible for that. These are her instructions, okay? She works with pelvic floor all day, every day. So she's amazing. So what we want to do is squeeze the muscles in our anus like you're holding in a bowel movement. So just think about that and try and squeeze those muscles and then relax. And squeeze those muscles and relax. We want to tighten and hold the pelvic floor muscles for 5 seconds. So what we're trying to do ultimately is draw up. Okay, so while you're sitting there, you're trying to pull up. We want to hold that for 5, 4, 3, 2, 1, and relax. I'm going to do that one more time. So drawing up. This time, actually before you start, this time you're not allowed to squeeze your thighs or your bum or turn your abs on, and you have to try and breathe. How's that for multitasking? All right, let's try that. So we're drawing up. It's the most important part. 5, 4, 3, 2, 1, and rest. So it's harder than you might initially think. But even if you're not getting it now, keep trying, because this exercise will help improve your continence. So it's going to help stop leakage. The big thing is that we want to try and not tighten anything else. So you might find it easier to do this when you're lying down. Often men can do this standing up, and if you're tightening it correctly, your penis should move, all right? So it should actually lift up a little bit if you're doing it correctly. One of the cues that we would use in Australia would be, imagine that you have a plate of ice directly below your testicles and you're trying to draw them up into your body, okay? So the Aussies are a little harsh. That's one of the cues that we would use that often men would be able to relate to, that drawing up feeling, because it's different to how we function as a female. So I encourage you to do that multiple times per day. The recommendation is at least twice per day. You're going to do at least 10 repetitions of 5-second holds. Okay, at least twice a day. Ideally, you're doing it 10 to 20 times, 3 to 4 times a day. That's kind of the goal. You can do this at any point, as long as you don't have your catheter in ultimately. All right, so straight after surgery, you'll normally have a catheter in, and normally it's not too comfortable to try this in, but any other time is good, before or after surgery. So what's the point of doing all these pelvic floor exercises? And exercising in general for our urinary incontinence? We know from the research that men who meet physical activity guidelines were 19% less likely to be incontinent at 6 weeks post-surgery. So without even doing pelvic floor exercises, men who did 150 minutes of moderate to vigorous physical activity per week and 2 resistance training sessions a week were less incontinent at 6 weeks than men that didn't meet those guidelines. We also know that a supervised exercise program once a week for 60 minutes that includes resistance and aerobic training has been shown to improve your urinary incontinence and your fitness levels. Now, if you were just doing that, you wouldn't be meeting the guidelines, but we know that even at a minimum, if that's what you did, that you'd be able to improve some of these levels. Another researcher has found that a 12-week exercise program after surgery improved incontinence. It also improved physical function and it improved quality of life. So in summary, get moving, because movement is going to help you, and do your Kegels, because your pelvic floor or your Kegel exercises are going to help to recover quickly from any incontinence that you may experience. And some men will experience bladder incontinence just from aging alone. I meet many people that prior to prostate cancer had some continence issues. So the cancer may have just made it a little bit worse when they had their surgery. Okay, the next side effect that we're going to talk about is fatigue. 70% of cancer patients experience fatigue. That's a lot of people. I've seen that number as high as 80% in some studies as well. If you just rest, you will increase your fatigue. So I meet a lot of people who are tired. They have cancer-related fatigue. They don't feel like moving, so they stay in bed. And it becomes a vicious cycle, because if we are sedentary for many hours in our day, we lose fitness. We lose strength. When we stand up, it doesn't feel as good. So we start to lose our independence and our confidence with movement. And what that actually does is it means that we move less and our fatigue increases. So it gets worse. We can minimize all of that just by moving. Your movement might look like standing on the spot and marching, all right, if you don't want to get outside. It might look like you're going around the block once or twice. Or it might look like you're going to the gym or walking for 30 minutes 5 times a week. Everyone's intensity and exercise at this level is going to be different. And tonight I want you to get the guidelines, and then we can figure out where you're at. Because if your guidelines are here, let's say the 150 minutes for you is here and you're currently doing 0, I do not want you to start by meeting those next week. We need to build a plan so that you can meet those guidelines over a safe time frame. So back to fatigue. It's important not to push too hard when you're exercising. So we want to start slowly and build slowly. Vigorous intensity exercise has been shown to be very effective, but only once we build up to it. So I don't want you to start exercising tomorrow for the first time in 5 years by doing something that's really, really hard, okay? Research shows us that the intensity and recommendations that you're going to need to do varies. So anywhere from 30 to 70% of your heart rate max has been shown to be effective at decreasing cancer-related fatigue. So what that means is I want you to start with what feels right now. So you try something small. So you might try something that feels really easy if you're doing nothing. And you try and repeat that and be consistent with that. And if that still feels easy and it's not putting you into bed, after your walk, let's just say it's a walk, then that's good, all right? And then you can increase the intensity a little bit and build up to those guidelines. We want to adjust our exercise as we need. You might have a bad day. Your fatigue might be a 9 out of 10 that day. Exercise on a 9 out of 10 fatigue day is going to look very different than exercise on a 3 out of 10 fatigue day. But we still want you to move. So some of my patients will do just a little bit of exercise on their really high level fatigue days. They're going to get out, they're going to walk slowly. It might look like 10 minutes. And then on their days when they're feeling good and maybe the sun's shining, they might find they can get out for half an hour and they still feel good when they get home. So something to think about. So research consistently shows us that correctly prescribed cardiovascular exercise and resistance training can reduce our cancer-related fatigue during treatment and into recovery. So what I want you to understand, though, is that exercise can be a stressor, which is why this says correctly prescribed. I meet many people who, by the time they see me, have experienced high levels of fatigue after exercise. They've gone out and they've done too much. They pushed a bit too far. They wanted to test themselves. They walked out till they got tired and had to turn around and somehow get home. And then they ended up in bed for a day or two. And that's not what we want, because that means that you exacerbated your fatigue because it caused you to be in bed for a day. So I want you to really monitor that if you're dealing with cancer-related fatigue, and make sure that if your exercise puts you into bed, then it was too hard and we need to do less, but still do it often. Consistency is key when we're working with fatigue. Some of the research into this area is coming out of Australia. There's some great researchers there right now that are looking at lots of cancer and exercise. And they found that during hormone therapy, 3 months of supervised exercise with aerobic exercise and resistance training significantly reduced fatigue. And these guys were exercising twice a week for 12 weeks. And they were guys with prostate cancer who were on hormone therapy. Another research group has found that after radiation, that resistance and aerobic training mitigated fatigue. This group was looking at 15 to 45 minutes of cardiovascular exercise 3 times a week. It was at a moderate intensity, and it was 24 weeks, the intervention. So 15 to 45 minutes, there's a big difference there. But people got to choose how much they were doing based on how their fatigue was that day. And that's what I want you to take away from that, is your exercise has to vary when you're dealing with fatigue. They found that resistance training generated greater long-term improvements and greater benefits with quality of life and strength. But they found that aerobic exercise, so cardiovascular exercise, reduced fatigue the most. There's something to keep in mind. So with fatigue, the most important thing to do is cardiovascular exercise, but we know that resistance is also important. Now I've included this bit of research that came out this year from an Australian group because I find it quite interesting. These guys did a 4-week study. They put people through 1 hour of supervised exercise a week for 4 weeks. And the exercise itself wasn't hard. It was just moderate intensity. And they found that even in that shorter time, they were able to improve strength, fitness, and function. So what I want you to get from that is that if you have fatigue, do something, because something will still improve where you're at now. So even an hour a week, that could be 10 minutes on most days. Okay, so 6 days a week, you do 10 minutes. You'll get change. And then we'll be able to build you up to slowly meeting those guidelines where we know will have greater long-term effects. Okay, body composition. So with many treatments, our body composition can change. Our body composition is basically the amount of muscle we have, the amount of fat we have, the amount of bone as well. But we're more looking at muscle and fat when we talk body composition. During prostate cancer, we know that patients who are on hormone therapy will have an increase in their body fat of about 10%. And a decrease in their muscle mass of about 4% during the initial 12 months of being on hormone therapy. That's quite a big change in your body composition. Normally, you'll notice it in your stomach and your abdominal area. So most men going through that treatment will put on fat mass through the abdomen, They'll put on fat mass through the pecs, okay, other areas as well. But they're the areas that they tend to notice it more. And they reduce muscle mass by about 4%, which might not sound like much, but it is reasonably significant. We know too that a reduction of lean mass following hormone therapy can reduce your musculoskeletal fitness. So basically the fitness of your bones and muscles. These compromises muscular strength, physical function, and your physical reserve capacity, which is basically your heart's capacity. So we want to make sure that we keep our lean mass so that we keep our fitness and our strength ultimately. A recent study that was published this year showed that patients who are on hormone therapy who completed 12 weeks of a combined aerobic and resistance exercise program were able to increase their muscle mass. So we know, and that there's lots of research that goes well beyond this year. We know that resistance training will increase muscle mass. And we also know that resistance training when you're on hormone therapy or when you're going through cancer, any type of cancer, will also increase muscle mass. Okay, so it's going to help preserve that muscle mass. Now, exercise is also, like aerobic exercise, is also going to help you with your fitness and control your body fat. Okay, so if we're doing aerobic exercise, we know that we can help to burn more calories and actually reduce some of our body fatness. There was a report that came out in 2014 from the American Institute of Cancer Research that demonstrated that an increase in body fat can lead to advanced prostate cancer. Okay, so if you have increased body fat, you've got more chance of getting advanced prostate cancer that's going to need treatments like hormone therapy and chemotherapy. They also found that for every 10 centimeter increase in your waist circumference, that you increase your risk by 12%. That's quite a bit, every 10 centimeters. 10 centimeters isn't much, it's 3 inches, all right? Everyone probably understands me now. 4 inches? Okay, there we go. I'm an Australian. I didn't grow up with inches. So for every 10 centimeter increase, 12% risk increase. 10 centimeters is about that much. So if you put that around your waist, it's a pant size, basically. We know we can reduce that by dietary controls and by exercising. In last year, actually, a group out of Australia found that a 3-month resistance training program was able to preserve lean body mass, so your muscle. It was able to preserve your strength and your function and prevent fat mass gains. So that's by just doing resistance training, so weight training. Okay, so that's really important. So when we're talking body composition, weight training or resistance training is key. That is the most important piece. And so most of you sat down when I asked you about weight training. So most of you are not doing it yet. So that's something that we need to add in. And I'll show you how to do that tonight, even just from home. So the summary for body composition is that both cardiovascular exercise and resistance training can improve your body composition. But I want you to take away that resistance training is most important when we're looking at body composition. Muscle atrophy. This one links in. Muscle atrophy is the wasting away of muscle. So it's defined as a loss or wasting of muscle mass. It happens when we're sedentary, okay, for longer periods of time. So if you ever have a hospital stay, chances are you have some muscle atrophy because you've been lying down for a longer period of time. It can also happen from some of our treatments. So hormone therapy has been shown to lead to muscle atrophy, so the wasting of muscle. We know that resistance training helps build our muscle and maintain it while we're on hormone therapy, all right? For patients who are on hormone therapy, it's been shown that 1 year of resistance training at a moderate to vigorous intensity was able to improve your strength and maintain muscle mass. This was from a group down in Portland that do a lot of, Portland researchers, they tend to do a lot of resistance training research with cancer populations, and they're finding some fantastic things in terms of muscle mass and fatigue. A 2014 review article found that exercise training benefited your muscular strength and your lean body mass. So our lean body mass is our muscle mass. So these programs, they're normally at a moderate intensity. Okay, they've been shown that they don't elevate your PSA. Sometimes people are worried about doing resistance training because they think that their PSA might rise. But there's been no evidence to show that that will happen. The PSA remains stable. The programs run for anywhere between 12 weeks and a year, depending on the research, and it's normally getting you to exercise at least twice a week. You can exercise with weights more than twice a week if you would like to, but we want at least 2 times. So what kind of strength exercises can we do? We're going to do this as a group right now. So put your paper away. I want everyone to stand up. I want you to look down at your feet and have them pointing straight ahead. And you're going to sit down. And then you're going to stand up. And this time I want you to not let your knees go together. So you're going to sit down again and make sure your knees stay basically above your ankle bones. They're not allowed to go in. And stand up. And let's have our arms out now. And sit down. And stand up. And this time you're only just going to touch the chair. So we're going to slowly come down to our bum just touches and then stand up. Did you feel how that was a little different? Yeah? And so really stick your bum back as you go down. Touch the chair and stand up. Did you feel your glutes working, your bum muscles working? That's a chair squat. You guys just did some squats. Well done. You can do it on a chair at home. It's very easy. You can have your arms here, or here, or here, or on the arm of the chair if you need to. All right? Now, if you find that your knees don't like a chair squat, we can do a leg extension. So seated, I'm going to get you to not kick the person in front of you, but lift your foot up. And then bring it down. And then lift the other foot up. And bring it down. And this time we're going to hold it as we lift it up. Squeeze the thigh muscle. Hold the foot up. So if you're sitting down watching television, this is a great exercise. It's going to build your quadriceps. And bring your foot down. And then the other one. You should feel that working in the thigh. This is great because it's unloaded. So even if you have bad knees, you can do this one. Well, most people, 99% of people can probably do this one. And foot down. Good, so you should feel your thighs a little bit. You might think of me tomorrow or the next day as you're feeling those muscles. Okay, stand up again. So for this one, I want you to hold onto the chair in front of you, if you have a chair. We're going to do a calf raise. So you're going to raise up onto your toes, up, and then down. And up, and down. And again, up, and down. Now if that feels really easy, you can go just to one leg. Coming up, and down, that's it, and up, and down. So you can use something to balance, coming up and down. Trying to come really high, and we're working our calf muscle, the lower leg muscle, which is really important. Make sure you change legs if you've been doing one leg and haven't been changing. So again, we're just coming up and down. All right, sit down. I'm going to show you the next one. You don't have to do it because we don't have enough space, but it's a wall push-up. So what we're going to do, you're going to find a wall at home and put your hands about chest height, so not up here, but down here, and you're going to lower yourself down and push away. So you're looking at the wall, lowering down and pushing away. This is a great way to start a push-up, especially because the ground's probably too hard for most people in this room. Okay? That's a great way. Now, if the ground's too hard, you could try a chair if the wall's too easy. So, with your hands on a chair, we'll just make do here, coming down and pushing up. And then if that's too easy, you can go to the ground on your knees or on your toes. And that's going to work all through your chest and shoulders. So there's lots of ways that we don't need any fancy equipment other than a chair, which I don't put in the fancy equipment category, to be able to do resistance training. And the one leg balance in heel to toe walking we did earlier. So that was where you were standing on one leg, right, balancing, and then the heel to toe, walking forwards, and holding onto a wall or a hallway if you need to. So there's a resistance training program that you could start tomorrow, provided that you're 6 weeks post-surgery or greater, okay? We don't want you to do too much intense exercise until that 6 weeks post-surgery stage if you've had a prostatectomy. Now, if you were doing these at home, for your chair squats, you do 8 to 12 of them, because that's the recommendation. And then you go and you might do your wall push-ups, and maybe you do 8 to 12 of those. And then maybe you've got, you know, a small weight or something at home that you could do some of these with, some bicep curls. You might do some arm raises. There's lots of different things that you could do to help work your whole body. Okay, moving on. So one of the other side effects that many people experience is osteoporosis or bone loss. Now, if we look at normal healthy bone, it's pretty dense. You see lots of little holes throughout it, but it's pretty dense. There's not as many gaps. Osteoporosis is shown with all these kind of wasted away spots. There's all this like honeycomb. Okay, lots of holes in there. Now, what happens when we get osteoporosis or even osteopenia? So we get lots of these little holes, and if we were to put extreme force in an area, like say we fell onto our hip, we could fracture that area and actually break it. So osteoporosis is the loss of bone tissue, leading to brittle and fragile bones, which basically means that they're more likely to fracture. A reduction in bone mass leads to an increased risk of fracture and associated disability. I'm sure most people know someone that has had a fall, and that's then caused them to not be able to be very active and lose their independence, okay, and lose their function. Correct exercise prescription can help minimize bone loss and may be able to help build up bone density. In a cancer setting, some of this research is still quite young, so it's not first-class evidence yet, but we have very good evidence to show. They will come back on in 20 seconds. We've got very good evidence to show that we can do some things to help maintain our bone mass and reduce the amount that we lose our bone. So we know that bone mineral density is lower in men undergoing ADT for prostate cancer than it is for age-matched controls. There we go. So if you're a man and you're on hormone therapy for prostate cancer, it's very likely that your bone mass is much less than someone who's the same age that is not going through hormone therapy. Lots of research that's been coming out in the last few years is starting to show that resistance training, when combined with impact training, can help skeletal adaptation. So this is basically, it can help your body to start to lay down new bone even when you're on hormone therapy. So there's a lot of research coming out of Portland and a lot of research coming out of Australia that's, again, it's not first-class evidence yet, but it's starting to show that with resistance training and impact training, we can start to improve your bone density. So what is impact training? These studies have done things where they make you jump. And I'm not suggesting you do this at home, but they're putting people through jumps like this. They do 10 of those, and they build that up. When before you even start jumping, you pretend to jump. So your first few weeks, you're just pretending to jump so you don't hurt yourself. And then you start jumping, and you build that up over time in a very, very supervised and structured way so that you don't hurt yourself. And what they're finding is that you're losing less bone as you're going through treatment. So some studies will show that you still lose bone mass, but you're losing less than people that are not doing this. So if you're doing weight training and you're doing the impact training, your bone is better than the people that are not doing that. A really interesting study that got published this year showed that patients who were on hormone therapy that did 32 weeks of recreational football training or soccer training increased bone density and physical functioning. So these guys are based out of Denmark, and they took a bunch of men with prostate cancer who were on hormone therapy, put them into some football programs, and trained them. And if you think about what a football player, what a soccer player does, they're sprinting, so they're accelerating, they're decelerating, they're jumping because people are competitive. It's a physical sport. They're kicking a ball, they're stopping a ball, lots of different movements. And that showed to be really, really effective in increasing your bone density and improving your overall functioning. Quality of life went up as well, not surprisingly with this study, because you're in a team with a group of other men that are going through the same thing. And we know that with that kind of supportive environment, that people's quality of life is going to improve. So that's something to think about. Now, if we look at the first study, the one by Kerry Winter-Stone and her group that came out last year, they had men that were 70 or older who were on hormone therapy. So this is to show you that you don't have to be 50 to increase your bone density. You can be over 70 and increase your bone density. They were not previously active, and they did twice a week in the gym with resistance training and some of the jumping I showed you. And they were able to reduce the amount of bone that they lost, and they showed signs of skeletal adaptation. So it's not do this and you're going to increase heaps of bone, but it's do this and you're going to lose less bone than the people that are not doing it, and that's going to keep your independence. So if we look at cardiovascular exercise for bone density, this is normally a question I get. So should I swim? Should I bike ride? Should I walk? What should I do? Now, something is better than nothing. Okay, so if you have known osteoporosis or osteopenia or you're on hormone therapy, remember to do something. Because at the end of the day, if you're doing nothing, swimming's better than nothing. And if you're doing nothing, bike riding's better than nothing. But if we had to rank them for bone density, nothing's obviously at the very, very, very bottom, and I don't want you doing that. Swimming is not as good for bone density as cycling is, which is not as good for bone density as walking is, which is not as good for bone density as something like running is. But you don't have to run to improve your bone density. It's just showing you in the different scale of things. So if you're walking, we can all pretty much, most of us can walk. It's a good activity for you. To make your walking more effective to build bone, you want to walk up a hill or walk up some stairs because the impact of that on your bone is much greater. So how this works is basically when we do resistance training or do impact loading kind of stuff, our muscles, where they attach to our bones, they pull on that bone. And that forces the bone to have to lay down new bone to get stronger. Okay, so all the little attachments on your bone from using your muscles help to make the bone stronger. Okay, so bone metastases. Since we're talking about bone, let's talk about metastases. So advanced prostate cancer sometimes has bone metastases, which is a basic cancer in your bone at a certain area. Now, if you think about having a cancerous part in your spine, that's potentially going to put you at risk of that part of your body having a fracture. And that could be really quite dangerous. Now, through some of the exercise, some of the studies, again, these guys are coming out of Australia. I promise you I'm not biased to Australia. Some of them are just doing, some areas are doing really good research there. They've been able to show, like early evidence, that appropriately designed and supervised resistance training programs are very likely that they're safe and well tolerated by patients with metastatic bone disease. So what they did was they recruited about 50 men, I'm pretty sure, and they put them into a supervised gym with exercise physiologists, and they knew all of their history. And so if you had metastases in your hip, then there were certain exercises that you were not allowed to do. So they basically avoided exercises where the muscles in that area were worked, but they did exercises around the rest of the body. If you had metastases in your spine, they avoided exercises in the trunk, and they exercised the rest of your body. And what they found was that your bone density around the area improved as well. So even the area that you were not working, got stronger and it was safe. So there were no adverse effects, and that area was able to get stronger even though we weren't exercising it. Because our body is a system. When we do something involving our legs, the blood and all the cells, it has to flow through your whole body. It's not just that area. So everything gets affected and impacted in a good way. So I think that's really interesting research, and they're continuing to do that. They're basically finding there's lots of really good functional benefits, and that they're pretty certain that it's going to be able to have long-term effect in a larger amount of people. So yeah, the exercise prescription was based on the area of the bone lesion, and that's where they avoided those areas. And here's what they improved. So muscle strength, fitness, lean mass, total physical activity levels, and these results remained at 6 months. And that's really important, okay? So it wasn't just for the 12 weeks of the study. The results remained at the end of the program, and then at 6 months' time, when they rang them up to say, how are you doing? They still had those results. Okay, cardiovascular health. Cardiovascular health is the health of our heart and our lungs. It's basically our fitness. Now, I said at the start, more men will die from more men with prostate cancer will die from heart disease than prostate cancer. So heart health is extremely important. If you are on hormone therapy, you're at risk of heart disease purely because of how hormone therapy impacts the heart, and then also how your body lays down fat and muscle, because we're increasing fat mass and decreasing muscle mass, and increasing fat mass in a way that it actually puts more stress on our heart. So cardiovascular health can be compromised during treatment due to the increase in body fat and abdominal fat. due to obesity, decreased muscle mass, elevated cholesterol levels, and increased blood sugar. All of those things impact the health of our heart. Chemotherapy can also sometimes be cardiotoxic. So sometimes the chemo acts on our heart in a toxic way that causes long-term damage and can reduce heart function. Lots of research shows that exercise, both aerobic and resistance training, is consistently linked to improved heart health and decreased risk factors for cardiovascular disease. Even to the point where if you're in our program and you have hormone therapy and you are at risk of heart disease, we can put you in a cardiac rehab program. That's how strong this evidence is. Because if you're on hormone therapy, you can come and speak to me later and we can look at how you can get access to a cardiac rehab program, because that's one of the best types of exercise for you if you're on that kind of treatment. Okay, let's talk about sexual health and libido. Lots of different treatments can impact sexual health and libido. Even just a diagnosis of prostate cancer without any treatment can impact this area. There's been research in more recent years that has looked at exercise helping with sexual health and libido, beyond all the other things that are available. Within our program here at the Supportive Care Program, we have nurses and doctors who are available to help you with erectile dysfunction issues and other sexual health and libido issues to help educate you on what you can do. So even with erectile dysfunction, there's certain things that the nurse and doctor can give and show you that will help overcome some of those things. Now with exercise, some research has shown that a 3-month group-based resistance training and aerobic training program was able to maintain sexual activity, increase libido, and increase feelings of masculinity. So that's really important. They took men who were going through hormone therapy and put them through a 2 to 3 times a week kind of program for a period of time, resistance and aerobics. So they're doing kind of everything. That's normally how these studies work. You get cardio and strength. And they found that by doing that they were able to increase their libido, all right? And they maintain their sexual activity. Now, when they compared that to men who were not doing the exercise, who were the control group, they decreased their sexual activity by quite a lot in that same period, all right? So something to think about. Exercise can help with these things too. So let's briefly talk about other side effects that you probably won't come across, but let's just throw them out there so you know you've heard about them. One is peripheral neuropathy. It's a tingling, burning, or numbing sensation that can happen in your hands or your feet from chemotherapy. It can affect your balance if it happens on your feet. So we know that exercise can help you maintain your balance if you have peripheral neuropathy and can help keep your function. Lymphedema, if you've had lymph nodes removed, lymphedema, especially for this population, can normally occur in the lower limb. So it's normally pelvic lymph nodes that are removed, and you might get swelling or edema in that kind of lower limb area. There's lots of exercises that we can do to help, reduce that lymphedema immediately and help prevent it from flaring up in the long term. Hot flashes, this is a common one. 80% of people who are on hormone therapy experience hot flashes. So, if you're not sure what they're like, speak to your wife or a female friend and she'll be able to tell you. But often people present with that constant hot flash type thing that's happening. The men aren't getting sleep. The fact you're not getting sleep is a whole nother thing that's combined with this. What we know we can do for hot flashes is diaphragmatic breathing. So if we all sit up nice and tall, we put one hand on our chest and one hand on our belly. I'm going to show you how to do a diaphragmatic breath. So our feet are on the ground. I want you to breathe in deeply and try and fill your belly with air. So your hand on your belly should go out. So let's just try that. So breathing in and breathing out. Let's try again. Breathing in and breathing out. So you might see that my lower hand is moving because I'm really filling my belly with air as I breathe in. I see some of you yawning. That's also normal. This increases the oxygenation of your body, which may cause you to yawn. So keep trying that. Breathe in, breathe out. So this uses our diaphragm. Our diaphragm is a really big respiration muscle that's going to help as we breathe in, fill with air, and then relax. this can calm you, but there's research to show that for hot flashes, diaphragmatic breathing can reduce the severity of the hot flash and can reduce the length of time that it lasts for.
So you do that with time?
So as you feel it coming on, you start the breathing, and it should help. That's what some of the research is showing. For mental health, we know that moderate exercise has been shown to help. Vigorous exercise has also been shown to help, but I want you to know that it doesn't have to be vigorous. Moderate is also helpful when we're looking at things like depression and anxiety. There's, again, research coming out all the time on depression and anxiety in cancer patients and in prostate cancer patients, and it's showing that moving is going to help you, and it's going to help reduce those numbers. There was research that came out a few months ago by Greg Levine and his group, which are unfortunately also based in Australia, and they found that even 6 weeks was enough. 6 weeks of moderate exercise twice a week was enough to start to reduce signs of depression and anxiety. That's not very long. It's really quick to start to see an effect. And quality of life. We have lots of research to show that exercise will help improve your quality of life if you have prostate cancer and are going through treatment, whether that be prostatectomy, whether that be hormone therapy, chemotherapy, etc. All right, we know that quality of life can improve from regular exercise. So long-term survival, there's some really interesting research in this area that shows if you're active and more active, basically, the more the better, and the more vigorous the better, that we can improve your chance of living. So in men with prostate cancer, physical activity was associated with a lower overall mortality rate and lower prostate cancer mortality. Mortality means death. So if you had higher levels of physical activity, you were at less risk of dying from any cause. Okay, we had a lot of numbers to go through, but let's talk about these because they're important. A group led by researcher Kenfield in 2011 published a study that had some really fantastic results. They found that men who walked greater than 90 minutes per week at a normal to brisk pace had a 46% reduction in death by any cause. Okay? They also found that greater than 3 hours a week of vigorous activity had a 49% lower risk of death by any cause. So 50% less risk just by working out about, what's that, 3 hours a week. So 30 minutes a day, not even that, you get a day off. 50% less risk of death from any cause. Men with greater than 3 hours per week of vigorous activity, when they were compared with people who did less than an hour, had a 61% lower risk of prostate cancer death. So hopefully this gets you moving, all right? This should get you moving to start with, and then hopefully moving more vigorously once you can. These guys found that men who exercise vigorously had the lowest risk of death. So we know that vigorous is important. It acts on your body in a different way. The researchers are still starting to figure out exactly what the mechanisms are behind that, but we know that it's different and it has very, very good protective long-term effects. The other interesting stuff is around body mass index and body weight. So our body mass index is our weight and our height. It's a number that we calculate. Research has shown that if it's over 30, which is considered, so 18.5 to 24.9 is considered to be normal. 25 to 29.9 is considered overweight. 30 and higher is considered a class of obesity. So over 30 is detrimental to long-term survival. Researchers in 2011 found that for every 5-point increase in BMI, you had a 21% increase in your risk of cancer recurrence, and this is prostate cancer recurrence, and a 20% increase risk of death by prostate cancer. So that means if right now we calculate your BMI, and let's say it's 32, we know that that's higher than it needs to be. Now, if you reduce that by 5 points, you're reducing your risk by 20 or so percent. Okay, so that's it's easy enough to do. We can reduce that through dietary means and through exercise. Okay, so it's a combination of things normally that will lead to that reduction. All types of exercise will help increase survival. So if you're sitting here thinking, there's no way I will ever do resistance training, it's not for me, I'm not going to do it, that's okay. You've heard how good it is for you. All right, so I've done my duty. We know that it's the one thing you can do that's really good, but all type of activity can help. If you're not a walker, do something. All right, do really vigorous housework, and that will help. All right, do vigorous gardening, play golf without a cart, and actually walk the distance. Okay, if you can, swim, row, whatever, but do something, and that's going to help increase your chance of survival. Some research that came out last year showed that engaging in 5 MET hours per day. Now, a MET hour is just a way that we measure activity, but engaging in 5 of these per day increase your risk of increased survival and decrease risk of death by any sort by 37%. 5 MET hours is about 20 minutes of biking. It was an hour of gentle walking. Okay, so it's not anything extreme, but again, doing something will decrease risk. Even a single session of low intensity exercise can have impact, and variety is important. So there's more and more research now into recreational physical activity, into looking at different things, because what we've learned is that not everyone wants to exercise. Not everyone will go to a gym, and that's okay. I meet people every day who say to me, "That's great, I hear what you're saying, but I'm never going to do it." So let's find a way for that person to do something they're maybe even going to enjoy, or at least do, even if you don't enjoy it. So how do you start exercising? How do you do this safely? There's a few things that we need to talk about. So safety. Before you start, you need to speak with your doctor regarding exercising and your exercising intentions. So have that conversation. If you're not doing anything now, have the conversation with one of your doctors that you're dealing with, and they will probably say, "That's great, I support you exercising, go and do something." All right? 20 years ago, they would say, "Do nothing, rest, it's bad." Now we have so much evidence that supports exercise as a medicine that no doctor will tell you that. They're going to say, "Go and exercise." And what I'm going to say to you is, if you don't know how, come and see someone like me to help set you up so you do it safely. If you're post-surgery or post-treatment, when is it safe for you to start? And I've mentioned this a couple times tonight. Post-prostatectomy, the first 6 weeks you're allowed to walk, but I don't want you doing heavy lifting. And you should get guidelines from your surgeon that tell you your do's and your don'ts. And if you don't, I can give you guidelines that tell you what you can and can't do. We know that bike riding is not good for you in the first 6 to 12 weeks post-prostatectomy. I haven't met a man that wants to sit on a bike seat in that stage. So generally we're okay there. Your natural instincts will guide you away from a bike at that point. Think about things like, if you have severe fatigue, your exercise goals and prescription might look different to your friend who maybe doesn't have fatigue. So when the people in your life are telling you, "Okay, we know you have to move, come out, let's go for a walk," if you're really tired, you might have to speak up and say, "I'm really tired today. I've got to only go for a block. I can only do 5 minutes. I can only do 10 minutes. Whatever that looks like." And make sure you speak up, because you're the only one that can feel that, all right? If you have lymphedema or low red blood count or known osteoporosis or another chronic condition or a weak immune system, these are things that can complicate your exercise prescription and reasons why you might need to see an exercise physiologist or a physiotherapist to get you started, rather than just doing it, all right? See a qualified exercise professional to help safely guide you with an exercise plan. And I say qualified exercise professional because there are a lot of people that will take you on if you want to move, but there are not many of us that actually know how to prescribe for cancer, especially if you're pre or post treatment or surgery. So keep that in mind. And through this program, you have access to me a few times. You can contact Phil or Manita, and they can put you on the list to get in when we have our next available appointments to come and see me for a consultation, and we can hopefully set you up with some guidelines around what you can do. Always include a warm-up and a cool-down. So a warm-up means starting a bit slower. Don't go in, if you're going to run or walk up a hill, don't start with that. Ease your body into it. We have to prepare the muscles. And then a cool-down is slowing down at the end and maybe doing some stretching. And the most important piece, start slowly and build slowly to avoid doing harm. So really think about that. If you've been inactive for the last few years or few months, don't go back to what you used to do. Try and forget that for now and go out for a small walk and think, how do I feel? What can I do now? Where am I at right now if I'm really honest with myself? And let's start there, because some activity is better than none. If we're looking at exercise planning, we want to set goals, so SMART goals. Most people I work with have heard of SMART goals and use them in business or their own goal setting. So specific and measurable, action-oriented, realistic and timely. We also know that if it's a goal that you really want to achieve, that it's likely that you'll be successful. So rather than just saying, I want to get fit and lose 5 pounds, we're going to put some more parameters around that. You might want to reduce your cancer-related fatigue. And we might do that by starting by moving for 10 minutes a day, 7 days a week. And then we're going to have a plan that each week we add 10% per day. So we add a minute. It's not a lot, right? And you'll be able to tolerate that. With our goal setting, we also want to identify barriers to exercise. What stops you now and what stopped you in the past? Is it time, motivation? Is it confidence? Do you not trust your body right now? Willpower? I meet people who tell me, I just don't like exercising. Well, that's okay, but you can still get it in there now because you've got health reasons to motivate you to move. How do you overcome your barriers? What can you implement to overcome them and to get moving? If you're unsure, come and speak with me, because I have never met a barrier that I can't overcome, with any of my patients. There's always something we can do. And don't forget to make it fun. You're allowed to have fun. So what are the next steps? So I mentioned the exercise clinic. So we have a prostate cancer supportive care exercise clinic. It's a one-on-one consultation. You get to come and see me. Our goal of this clinic is behavior change. So we're trying to get you at any stage and help you understand how you can exercise, and we'll set some goals. We don't exercise in the clinic, all right? But I set you up with goals, and you go away, and I can see you at kind of the start, and then at 3 months, and 6 months, and 12 months. And we're changing your behavior and keeping you accountable. There is a cardiac rehab program, which is located on the 6th floor of the Diamond Healthcare Centre, which is this building, for patients who are on ADT or at a high risk of having cardiovascular disease. There are local community programs and companies around. I work at a local company just down the road. My cards are up on the table. I consult with people one-on-one all the time. It is fee for service, but it gives you access to someone in the area that is a specialist ultimately. So I can set you up with the guidelines that you need now. If you want to train one-on-one, we can do that. If you want a home program, we can do that. We can do whatever it is you want. There are other community programs around. I'm leading a program right now called True North Lifestyle Management. It's a free exercise program for men with prostate cancer. We're hopefully going to implement it across community centres in BC, and it's across the country, funded by Movember and Prostate Cancer Canada, and you'll be seeing more of this soon. So that's the kind of thing that if you're interested in a 12-week program, twice a week, we're doing 2 more pilot studies this year that you may be able to sign up for. So I'll keep you posted on those if you're interested. Just come and chat with me. We have a physical activity line that you can call. The PAL line is great. You can call them, you get in touch with a physiotherapist or a kinesiologist, and they have some experience with dealing with someone who wants to get more active that has a cancer diagnosis. They're not normally specialists in the area, but they can give you guidance on what's around your local area. And then there's research studies. So you may qualify for a research study that involves exercise that gives you access to this for free. If you're looking at returning to work and you have extended medical, they will often also fund the 3-month period before you return to work, working with someone like myself, one-on-one, to prepare you for that return to work. So that's something else that's available for people that are returning to work at some point through their extended medical company. So that's kind of what you can do next. Some of it's at a cost, some of it's for free. There are physiotherapists in every community. Even a physio that has very minimal cancer experience will have good musculoskeletal knowledge and will be able to help you with basic movement. So in summary, these are the numbers you need to remember. 150 minutes of moderate to vigorous intensity physical activity per week. 2 resistance training sessions per week. Flexibility on days that you exercise. Balance every day, let's say. And here's a summary. You have this slide of how different exercise can help all of those different side effects. Remember that your exercise planning includes goal setting, identifying barriers, and writing a plan down. So if you don't have stuff written down, when you get home tonight, write it down. What are your goals? What do you want to achieve with your body? Do you want to just improve your bladder incontinence? That's a big goal. Okay, we want to make sure that you can get there. So how are you going to do that? You're going to do your Kegels daily, 3 times a day, for the next 2 months to try and improve that. That's potentially one way. So start thinking about what you want to achieve and write it down. And if you're unsure if that's realistic or not, email me and I'll help you understand how to kind of piece that together. All right, so that's all the talking that we need to do tonight. I'll be around if you have any questions you want to ask me one-on-one afterwards. Thanks.